Hello everyone and welcome to the MSF Paediatric Days. Many of you may be wondering why pediatrics, and I have three main reasons why. The first one is related to the fact that still under 5 years old mortality remains a worrying pattern. Although there was substantial global progress that was made in reducing child deaths since 1990, the global under 5 mortality rate has dropped by 53%, but still remains a huge concern, especially knowing that an estimated 15,000 children suffer premature death every day. The second reason is related to the fact that a growing proportion of neonatal mortality. We see 3 out of 4 of neonatal deaths that occur within the first 7 days, and one-third of them within the first 24 hours of life. And the third reason is related to neglected diseases and neglected social patterns. And then, why Paediatric Days? In global terms, pediatric tools and guidelines need to be adapted to our theaters of operations. Indeed, most evidence-based practices were generated in high-income countries and are often not transposable as such. Operational research efforts, therefore, need to be consented in the direction of generating new tools and adapting existing ones in the meantime. Thus, the MSF Paediatric Days is an event for field staff, policymakers, and academia to exchange ideas, align efforts, inspire, and share frontline research to advance urgent pediatric issues of direct concern for the humanitarian field. In this event, we should be aiming to identify gaps in knowledge, research, and development on medicine and diagnostics, to understand the latest evidence and adapt practice as much as possible, to generate possible solutions and useful recommendations for contexts where MSF and other humanitarian organizations work, and to participate in bringing pediatrics to the front line of MSF priorities. Thus, for this year, we're going to discuss several very interesting topics like neonates and the absolute necessity to go back to basics. We have an essential newborn care, reinforcement of mother and baby dyad, and of course the breastfeeding. We're going to talk about community-based models of care for neonatal and child health. And we're going to talk about the gap on the continuum of care, the important role of community engagement as an essential part of the health system, and of course all the challenges and opportunities that arise as more MSF sections are integrating decentralized models of care in their patients. And we're going to talk about pediatric tuberculosis. TB is still, unfortunately, a frequent disease among children in most of MSF projects. We're going to talk about antimicrobial resistance and antimicrobial stewardship in neonatal and pediatric care. And last but not least, we're going to talk about the collateral damage of COVID-19 on child health. All those ripple effects that we see that have affected a lot also the very young populations. So for all these and for many other reasons, I would like really to welcome you again in these Paediatric Days and wish you fruitful debates.